Welcome to a brief pause. We take a moment to discuss a wide variety of pet related topics like training, grooming, veterinary, health concerns, new fashion trends. Today, we're going to be talking about flea and tick preventative and medication. Obviously, there's a lot of questions there, but there's also been a lot of inflammatory articles out there that I'd really like to talk to the experts about. And today, our expert is Dr. Stephanie Liff from a very busy Seven Veterinary Clinic and Health Kitchen, New York. Welcome to the show, Dr. Stephanie Liff. Dr. Stephanie, can you tell us how long you've been a veterinarian and when you opened Pure Paws and Health Kitchen?
So I've been practicing since 2009. I trained for 1 year at Blue Pearl in Midtown, and then I worked at a practice on the Upper West Side for 3 years. Then I moved to Pure Paws in Brooklyn in 2013, and we opened Pure Paws Health Kitchen in 2016.
Very cool. And it's a very busy clinic. You've got seven veterinarians there, right?
Yes, we do.
Yeah, it's
Yeah.
amazing. I've seen it. It's a very bustling place. You guys are a well-oiled machine over there. So we're getting into springtime, right? It was very, very concerning about Lyme disease and all these things. So everyone starts flea and tick preventative, but especially for a new dog owner or a new cat owner or, anyone who may go on these things, this is a lot, right? There's a lot of products, there's a lot of information, and you see something on the grocery store shelf, but then you see stuff that's prescription for the vet, and it's a big world, and I'm sure many people have a lot of opinions on it. Um, so I wanted to ask the expert a few questions about these flea and tick preventatives for anyone in the country, right? So first of all, what animals? Is it just cats and dogs that go on these medications?
So typically we're just putting cats and dogs on preventatives. In my office, more dogs than cats. Most of my cat patients don't leave their homes and usually live alone. If my cat patients live with the dog, then sometimes I do have them on preventatives as well. Or if they go outside, they need preventatives. But all of my canine patients, unless they are 100% housebound, need to be on flea and tick prevention. And we're already getting calls about pets coming in from being outside with ticks on them, even in the city. So it's really important. And we recommend it year round because the season seems to keep getting longer and longer.
Yeah, I've seen it myself. Now, do people end up using this on like rabbits if they let them go, pet rabbits if they let them go into their backyard or guinea pigs, anything like that?
So Revolution is safe for small mammals as well. Not all of the other products are, so you just have to check the label. But bunnies that go outside definitely can be at risk. They also get a type of lice called Cliletiella that can be contagious. So it depends on if they're living with other pets and what their lifestyle is.
Great. So we see these products at the vet clinics and their prescription products, but we also see things on the grocery store shelves. What are the difference in those? Because they look very much the same, and obviously there's a different price point, and one doesn't need a prescription. So there's got to be a difference. What is that?
So prescription products typically involve the prevention of heartworm. Usually flea and tick products are not prescription, but could be veterinary recommended, where they would be sold only at veterinary outlets. So online pharmacies, veterinary offices. Then there's a difference between oral and topical because topical products are regulated by the EPA and oral products are regulated by the FDA. And so that makes a difference as well. In general, you want to be careful of your source because we do see counterfeit products, and that leads to some of these scary stories about efficacy and safety. And so you want to make sure you're getting it from a place where it's sourced from the manufacturer through a distribution channel into your home. You don't want to be buying it on Amazon, can be questionable, and other obscure locations that could maybe have counterfeit product.
Yeah, actually, I have heard that before with some of the online services, like subscription services, that sometimes they look real. So overall, it's safest to buy products from your vet. It's not necessarily prescription, but you know that it's been, you know, vouched for. It's the real deal. And I'm assuming then your veterinarian can put you in the right direction for your animal. I know it's very important to get the right size and weight per product, right? Depending
Yeah.
on what that is, it's meant for a very certain size and weight.
Right. So the safety profiles are pretty broad, and so if you do overdose your pet, it's unlikely to cause a problem, but it's not necessary. So it is important to talk to your vet about what's appropriate for your pet, and also with so much variety, every product has a little bit of a different niche in terms of who it's best for. So Some small dogs won't take the oral product and topicals are better. Some larger dogs, you know, topicals make them really messy and oral products are better. It really just depends on what the lifestyle is, the size of the pet, the breed, etc.
Right. So it sounds like the stuff at the grocery store you would not recommend.
Typically, I prefer people to buy their pet products from a pet store or a vet or an online pharmacy.
Got you. That makes sense. I've heard some stories myself about even flea and tick shampoo from the grocery store. I don't want to say too much, but I'm in shock that some of these companies still exist. And I
Right.
would also say it's worth whatever extra money that is in the long run to do it right and have it veterinary recommended at the very least, or like you said, a pet store, pet professional in general. So what products are you liking right now? Because I feel like every year or every couple of years, there's a lot of new stuff on the market.
So we generally recommend oral preventatives in our office. The kill speed is really good. It's within 30 minutes. It kills really effectively. It's about like 98 to 99% effective, which is great. It's a departure from some of the older style products like Frontline that was more like 96, 97% and losing efficacy at the end of the month. So we really like the orals. They're clean, they're pretty easy to give, and usually the pets will take them. The only downsides of the oral preventatives is that you don't get a repellent benefit. So like Advantix and Vectra and some other products repel bugs. And so that doesn't happen with the orals. The bug has to bite the dog in order to get the drug in order to be killed. And so you will see ticks on your dog sometimes. Typically you won't see fleas on your dog because they're on and off very quickly. But that is one thing that we do notice a difference in the orals. For topical prevention, I think by far the most superior product is Vectra 3D. It kills fleas, ticks, and mosquitoes. So for dogs that are really sensitive to mosquitoes, it's helpful for that. It's safe. It's been on the market for a long time. I don't think they've ever had any recalls. So those are my favorites. And then I use the Seresto tick collar. My own dog is a very hairy black Labradoodle. I would never be able to find any bugs on her. So she takes Bravecto every 3 months and she wears the Seresto collar year round.
Yeah, I was going to ask you about combining things because say a dog is wearing those collars or using medication, which ones can they double up on and which ones are unsafe? And that includes the shampoos and things like that.
So the topical shampoos can be a little bit toxic and definitely drying. So I'm not a huge fan of those. I think like if your pet gets exposed and you're trying to remove ticks, just like a standard shampoo is fine as long as they're also on prevention. We have a lot of our clients double up on oral and Seresto. That's been our protocol, especially for pets that go out east or up north where they encounter a lot of ticks. And it's been really effective for my dog and most of my clients. I think either product used alone, you're definitely going to see some bugs on your dog. Nothing is perfect. And those are safe together. The topicals, you just have to check on the active ingredient to make sure there's not an interaction. But I went to school in Florida and we alternated every 2 weeks using Frontline and Advantix, like alternating first of the month and 15th of the month, even though that's off-label use. And that was considered safe as well. So most things, if directed by a veterinarian, are going to be safe. You just need to double check.
Yeah, I bet people in the South really have to do what they can. I mean, like you mentioned, mosquitoes and the ticks. I mean, they probably never let up in those areas, right?
Yeah. Fleas are really a big problem in the Southeast. So that's their biggest issue. Up north, we have more of a tick issue.
Yeah. And I do want people to know specifically in New York City, just talking about where I am, that your dog is not immune to it, even if you do not leave New York City very much. They are in Central Park. They do spread around in the parks in general and the dog parks because people don't all stay in New York. They have homes upstate and other places, and the dog goes on vacation and then they bring it to the park areas here. Right. So they are here.
Yeah,
and they're spread by other animals.
Exactly. Like small rodents, small mammals, birds. So ticks can move around. And we've definitely even seen a rise in heartworm in the area. It's not a huge concern still, but we definitely are seeing it. We definitely recommend prevention year round.
Yeah, stay on those monthly chews. So the other thing I wanted to talk about is I feel like every year, every couple of years, there's some articles about one of these types of medications that has had a lot of deaths related to it. This past year was Seresto, right? And I see that Seresto collar on so many of my clients and I've heard no complaints, verbally. Are these inflammatory and clickbaity, or what's going on with this stuff?
So I think in general, for any news that you're consuming, it's always important to consider the source. And I think these articles are really evidence of that. So there are some sort of like green organizations that are really anti-pesticide in general and will write these articles. And the sources that they're using to make their claims are a bit questionable as well. Seresto in particular, my dog wears that. So I called the manufacturer immediately upon seeing that article. And they have sold over 25 million doses in America with a 0.001% adverse reaction rate, which is extremely low. The vast majority of their adverse reactions were topical irritation because it is a topical product, and death was really not on their list. Any pet that is wearing a Seresto collar at the time of death might be classified as a death under the Seresto guidelines, but that doesn't mean Seresto killed it. So the 16-year-old dog like dies of cancer. If he's wearing Seresto, he could be included in that list.
Oh, that's
And that's where this,
interesting.
yeah. So the statistics can be a bit confusing.
Oh, that's super interesting. It's crazy how that stuff works, and I'm sure, obviously, media can get a hold of information like that and run with it because
Yeah.
that would definitely scare people. So, if people find fleas or ticks on their pet, whether or not they're using a medication, what should they do?
So for fleas, bathing can be really helpful. So if there's fleas in your dog, you can bathe them with dish soap. I typically recommend Palmolive. The green one with aloe in it is not that drying, and that will get most of the fleas off. You can also like re-administer an oral tablet, especially if you're nearing the end of the month of efficacy. So if it's next guard and you give it monthly and you're on, you give it on the 1st, it's the 28th or something, you could definitely redose. That will help too. Ticks are a little bit harder, so you can bathe, but ticks are they're embedded in the skin, and so water will not get rid of them. And so what I typically recommend is that you remove each of them manually. Also, make sure that you're current on your preventatives because those will kill through the blood. And the best way to remove them manually is to put either a dollop of soap or Vaseline on the tick and spin it counterclockwise, and it should back out of the dog so you don't leave any pieces behind.
Oh, great. And if you are on a preventative and the tick bites and then dies on the dog, does that mean that you probably do not have a chance of the dog having Lyme disease, or cat?
So Lyme disease takes at least 48 hours of tick attachment to transmit. So the oral preventatives are actually labeled for the prevention of Lyme because they should kill faster than that. But there are other diseases that we worry about, like Ehrlichia and Anaplasma, that transmit very quickly. And so we still recommend testing sometime within the 30 days after the tick is found on the dog. I'm generally on the proactive side, where if you're seeing a tick on your dog, you probably didn't see many other ticks on your dog. So I usually test at the time that we remove. And if the test is negative, then I'll do it again in 30 days.
Oh, okay. Well, there's some dogs and cats then that will be getting a lot of tests throughout the summer because I feel like I
Yeah,
pull a lot of them off. Yeah,
right. We
but they
typically
definitely
don't
work
test
well.
cats. Yeah, cats are pretty resistant to tick infection, so we typically don't test them. They have other like vector-borne diseases that we do worry about, like babesia, but we don't worry as much about Lyme disease and other tick diseases in cats, although rare instances have been reported.
Yeah, and to speak a little bit on Lyme disease, it's definitely grown over the years. It's become a larger problem and a bigger concern, and it's in more areas, I believe, than 20 years ago when I started. So, quickly explain why there's a vaccine. Should everyone get the vaccine, and what happens if you don't?
So there is a vaccine. It's fairly effective. It's given annually, and it prevents against the tick transmitting the disease to the dog. So that's really helpful. It really depends on lifestyle. For people who take their pets hiking or into like tick-borne areas, then it's definitely a worthwhile vaccine. The best prevention for dogs that are at risk is checking for ticks every time they go outside, giving an oral or topical flea and tick prevention and vaccination. So it's a three-pronged approach, which is really important because nothing's perfect. And Lyme disease is important to prevent because it can kill. So it has several different areas which it affects the body, but the main ones that we see are the kidneys and the joints. And so these dogs will get chronic arthritis, or they'll get something called Lyme nephritis. which can permanently damage the kidneys. So prevention of that is really important. And the preventatives, even if you're just doing one of them, should really prevent Lyme disease. You still may get infected, but you shouldn't see the disease that you would see without a dog who's protected.
Sure. And just as a groomer, I want to add where you can be looking for them and what helps to try to find them. Inside ears, warm, nice area, areas you typically wouldn't put your face in. You might want to go ahead and look in those areas and get it groomed often. We have a lot of people that take them shorter in the summer to try to see better, to see if they've gotten flea and ticks. And the groomer has something called a force dryer, usually, or even just the process of our hair drying separates that hair, inch by inch, where we're looking at the skin all the way over. So it can be helpful throughout these seasons to have your groomer take a good look just by the main process of grooming is how we would end up seeing those. So if you're concerned, get them groomed regularly. It might ease your mind a little bit. But like you have the, very thick coated dog, it still can be hard. And so just, luckily she's lucky to have a vet for a mom. Is there anything else that you want people to know about these medications or this concern at all?
So I think the most important thing to always remember is sort of what we said in the beginning. So number one, the preventatives are meant to prevent a bad disease. So prevention is always better than treatment. And then it's important to to talk to your vet about your specific pet's needs, because we really try to tailor our recommendations to your pet and their lifestyle. It's not like a one size fits all kind of plan. And so it's important to ask and be forthright about what your plans are. If your dog's going to swim every day, or if they're going to be at the beach or in the mountains or running around on 40 acres, those things are important for us to know so we can guide you accurately.
Awesome. Well, thank you so much for all this information. Hopefully it's really educated people and maybe calms their fears from some of these articles that come out and scare people to death, because it's, you don't want to hear that, you're putting your pet on something that could kill them. Thank you so much. Is there anything else you'd like us to know?
I think that's it, but thank you for having me.
It was really good to see you. We will talk to you soon, I'm sure.
All right. Sounds good.
Thank you for listening, and follow us for more wherever you get your podcasts. Also, check us out on Instagram at A Brief Pause.